Hi, welcome back to my channel. So in this video I'll be talking about clasps in orthodontics. So first of all, you should know that clasp is basically a retentive component in the removable appliances. Alright, so starting from the first one, so this is the C clasp. You can see it forms a C. The thing about this is that it is also it is basically, just give me a second. It is basically a circumferential clasp, and it is also called as 3/4 clasp. All right, then you should know the undercuts that they involve. So in this you can see that it involves the bucco-cervical undercut. All right, and the basic disadvantage is that it cannot be used in partially erupted teeth. Also, it leads to the decalcification of cervical margins and leads to plaque retention and gingival irritation. Then you should know the wire. We use 0.7 mm wire. Either you can make it on a canine or you can make it on a molar. All right, and it has a single retention arm. Now let's talk about this one. So see, this is a total U. See, C was this and this is total U. So you can call it as a U clasp. All right, so this is a U clasp, or you can call it as Jackson's clasp because it was given by V.H. Jackson, or you can call it as a full clasp. Okay, now this is again made up of 0.7 mm stainless steel wire. Now see, it involves the buccal plus the proximal undercut. All right, then this one was asked once in NEET, so as image based question, so you should know that this is the third one, right? So this was the second. Third is Crozat's clasp. Now this is basically full clasp plus, just write it with red. So this is full clasp plus a straight wire is soldered at base in a crescent form which engages the mesiobuccal and the distobuccal undercut. All right, now let's talk about this one, fourth. So this is a south end clasp. Now this involves the undercut between two incisors. It is most commonly used for additional retention, and it is contraindicated in proclined anteriors. Now let's talk about this one. Now, this is fifth. Now this is Schwarz clasp. It is also called as arrowhead clasp. Now this basically engages mesial and distal undercut. Advantage is allows free eruption of teeth, more flexible. Disadvantages requires special plier. Now let's talk about this one. So sixth, this is the triangular clasp. It is also called as modified Zimmer clasp. Now this is an accessory clasp. Now see, this is 654. So this is placed between two premolars, can engage elastics, 0.7 mm stainless steel wire, open end is always placed distal. Now let's talk about seventh. So 7th, so this is ball end clasp. Now it is similar to the action of the triangular clasp. Disadvantage cannot be used if adjacent teeth is absent. Now this is like the commonest, and this is Adams clasp. So it has basically a bridge, then it has two arrowheads, then it has two tag arms. Now this can also be called as universal, Liverpool, or modified arrowhead clasp. This was given by C.P. Adams in 1950. Then you can use it in anteriors as well as in posteriors. Anterior 0.7 mm and posterior 0.9 mm. Then this bridge should be 2/3 the mesodistal width of tooth, and length should be intercuspal distance between buccal cusps. Then here we have a 45-degree angle. Alright, then coming on to the modifications. Now these are important and they are asked, so be thorough. So this is you can see it has a single, see there is no arrowhead, just one arrowhead. So this is a single arrowhead clasp. This is with J hook. This is with eyelet or helix. Then this is additional arrowhead. Then this is with soldered buccal tube. This is for with distal extension. This is on incisors. Now see, single arrowhead clasp. So this can be given in partially erupted teeth. J hook is for elastics. Helix is also for elastics. Additional arrowhead for additional retention. Solder tube when extraoral, when you have to like attach the headgear. Then this distal extension for more retention. Also you can add elastic. Then on incisors. Then coming on to this one, so this is particularly different from what all we know. So this is 9th. This is called as a Resta clasp. Now in Resta clasp we have ball end, this one, ball end clasp, plus we have arrowhead retentive arm of Adams clasp. So it basically is a combination of both. Then it engages two undercuts on buccal surface. It is used when interocclusal clearance is available only on one side. Now last 10th. So this is Delta clasp. So this was given by Clark and it is used in twin block. The only difference is that it has a closed triangular loop, unlike open V-shaped loops of Adams. So with removal of appliance, there is no effect on the loops. Alright, so this is about the clasps in orthodontics. If I made it easier for you to understand, give it a like, share, subscribe. Thanks for watching.